You know, the good news is we have tons of information right at our fingertips, right? You go to Google or whatever search engine you like, type in any health issue you have, and out pops thousands of pages with thousands of experts. Of course, the bad news is we have a lot of information at our hands. So who can you really trust, and what sources can you really trust? So I want to introduce you to a book that I think you can trust, and that is the Disease Prevention and Treatment book by Life Extension in the 5th edition. And my guest is Dr. Stephen Joyal. He is a graduate of Dartmouth Brown Medical Program in 1993. He's been an internist. He's worked in the academic world, the pharmaceutical world, and now he's the Chief Medical Officer for Life Extension. Dr. Joyal, welcome to the show.
Privileged to be here. Thank you.
This is a big book.
It's large.
Yes. What, this took you about 2 weeks?
If only. Yeah. This really is a labor of love. This is, of course, as you mentioned, this is the 5th edition. It took about, 10 years from the last edition to this edition. So we put a lot of blood, sweat, and tears into this publication.
So 130, and I like the way you say this, evidence-based protocols,
yes.
Which means, you know, this is backed up by the science.
Yes,
right.
Scientific evidence, scientific support. We are very proud of the book. We copiously reference this. That way, if people have any questions, hopefully they bring this to their physician to inquire about some of the strategies that we discuss in the book. But if there's any question, they can go to the references and look up the actual peer-reviewed reference to review.
How do you envision people using this book? Are most people going to read this cover to cover?
No, I don't think so.
Right.
But interestingly enough, we do have a few members that we talk to, and they do read it cover to cover, interestingly enough. But this really is useful as a definitive reference guide.
Okay.
And really what sets this particular publication apart, and it really is unique, is it blends conventional medicine with what I'd call translational biology. We're both physicians. Unfortunately, often the science lags behind what we call standard of care. And the vision for this book really is to bring to bear that translational evidence from biology, whether it's animal studies, other clinical studies, that hasn't made it to the forefront of standard of care yet. So this really is designed to be a definitive reference guide that blends the best of conventional medicine with the best innovative scientific findings from around the world.
And so the audience is really doctors, consumers.
Yes.
Just about, this applies to just about everybody.
Yes, all of the above.
Let's talk about some of the information that is in here. I mean, again, 130 protocols. So the big one that sticks out to me is refined sugars, right? They're all over our diet today, and we're getting a lot of it, and we know there's a lot of consequences. And there's a lot of protocols that relate to that in this book. Let's just start off with something simple. Why is excess sugar so dangerous to us?
Well, I think we can focus in particular on one type of sugar. Let's talk about fructose.
Okay.
Now, fructose, unfortunately, seems to be ubiquitous in the American diet. What I often tell patients, people that I counsel, is make sure you read food labels. You'd be surprised at the appearance of high fructose corn syrup in a variety of commercially processed packaged foods.
Kind of hidden in there on the label.
Absolutely. Now, the problem with fructose is that it's metabolized a little bit differently than other sugars. It does something, for example, that is not a great thing. This sugar raises a level of blood fat called triglycerides in our body, and we know that elevated triglyceride levels are a risk factor for a whole host of things, from insulin resistance to hypertension and to obesity as well.
So here we're taking in some fructose that maybe we don't always know.
Correct.
That gets into the liver turns that into fat, and there's a lot of consequences from that.
Bad things happen, that's
correct. And so there are a lot of protocols that address this, right,
yes.
in this book. What are some of the dietary things that you might suggest, or nutrients you might suggest for people who are dealing with a lot of sugar in their system?
Sure. Well, there are a variety of things that we offer. Let's talk a little bit about something that's very close to my heart, so to speak, and that is metabolic disease. We really are in, I'd call it an epidemic of metabolic disease, particularly type 2 diabetes, but also the so-called metabolic syndrome, which is characterized by high blood pressure, elevated levels of triglycerides, suboptimal levels of the so-called good cholesterol called HDL, as well as impaired glucose levels in the body, and being overweight as well, having a lot of central body fat around the abdomen, around the organs in our body. Well, one of the things that we talk about in here, and it's actually applicable to a variety of different health conditions, is a phenomenon called glycation. Now, what is this thing called glycation? Well, if you've ever made toast, you've seen glycation. And what glycation is it's a process where dry heat forms a bond between proteins in a food and carbohydrate. And toast, that browning reaction, also called the Maillard reaction, named after a chemist, the turn of the last century, that particular reaction produces these things called glycation end products. And they have adverse consequences in our body. So there are a variety of things that we can do to minimize that, from the types of food we eat as well as supplements.
Okay. So when you talk about metabolic disease, you're talking about a whole constellation
Spectrum
of things.
Correct.
That we're seeing. Really, many of these things are rampant in our society today.
Yes.
And a lot of it does link back to the excess sugar, the fructose, and this glycation reaction.
Yeah, let's face it, obesity, what is the latest statistics? I think almost 2 out of every 3 Americans is either overweight or obese. That's a big problem, particularly as we look over the next 20 years. You think, too, when I often talk and lecture about this topic, think about the pediatric population, kids.
Bad,
now,
yeah.
when we were kids, you might have had 1 or 2 overweight classmates. But if you look now, you see the mass majority of kids are overweight. Now, there are a lot of ideas around why that's happening. It may be linked to reduced physical activity. It's probably a combination of that, as well as the fact that our diet, kids are eating more of these commercially processed foods, and they're eating more of them, the so-called supersized generation, where they're eating double, triple what, let's say, we did 30, 40 years ago.
And a lot of those sugars are hidden in there, like the corn syrups and stuff. They're hidden
High
in those
fructose
labels,
corn syrup
right.
it seems like it's in all kinds of processed foods.
Now, there are a lot of protocols, I think, that address weight in here, but what I
Yes.
want to go to is another one that is a huge problem in this country, is heart issues, right?
Yes.
There's a lot of protocols in this book that cover how to have a healthy heart.
Yes.
And there's one nutrient that seems to be consistent in those protocols, and that's CoQ10.
Yes.
That
Yes.
must be important to Life Extension yourself, and I know it's important to me.
Yes.
Tell us, first of all, what is that exactly?
Well, CoQ10 is an enzyme, and it's very important for facilitating what we call energy production in these very important organelles in our body called mitochondria. And what mitochondria are these energy powerhouses of the cell. They essentially take food energy as well as oxygen, and they convert it into a form of energy called ATP. Remember our high school biology, adenosine triphosphate, that's used by the cells. So CoQ10 is very, very important in helping to facilitate that. Now, you had mentioned cardiovascular health.
Right.
Very interesting recent study called the Q-Symbio study. It was presented as an abstract at the European Society of Cardiology meeting a few months ago. These researchers looked over a period of 2 years at approximately 420 individuals who had class 3 and class 4 heart failure.
Which is pretty bad overall, right?
It's pretty bad. There is significant functional impairment.
Right.
And so what they did with 2 groups within the study. One group got placebo, the other got 100 milligrams of CoQ10 3 times a day. And the results were really remarkable. What they showed was that the group that was supplemented, their risk of a cardiovascular event, a major cardiovascular event like a heart attack, was 14%. In the placebo group, it was 25%.
That's pretty
So if you think
significant,
about
right?
the
Yeah.
relative difference, this is about a 40% decreased risk over just 2 years of having a major cardiovascular event, only with supplementation with CoQ10. So some really remarkable results.
And that's the type of information that they can find in this book, right?
Yes.
That's what you mean by evidence-based, that you're
Yes.
providing that kind of information to doctors and consumers alike,
Yes,
right?
this book is terrific for not only
Let's see the size of this book
concerned
again. Look at it. It's pretty
health
hefty.
professionals. Yeah, it's over 5 pounds. Not only for concerned health professionals, but also for the lay public who's interested in maintaining optimal health.
How can people learn more about this book or even purchase it?
Oh, great. You can go online. We have a wonderful website, www.lef.org. We have tons of information on not only health topics, but literally anything related to health and wellness you could possibly conceive.
It's all there, yeah.
It's all there. And a lot of this information is available as well. We have online protocols too, but many people love to purchase the book. It's a fantastic reference tool.
Nice, very nice. Dr. Joel, thank you for coming on the show.
Thank you.
Coming up next, as I see it, the issue is your health. We'll be right back.